This content is AI generated for informational purposes only and should not be directly used for clinical decision-making.
Hello, and welcome back to the Neurosurgery Hub podcast. I'm Dr. Aris, Senior Attending Neurosurgeon.
And I'm Dr. Alara, Research Fellow. Today we're looking at a fascinating new study from the journal Child's Nervous System, published in 2026. It's titled Long-Term Subjective Patient Satisfaction and Aesthetic Outcomes in Sagittal Synostosis, a study of 488 patients operated by early wide-open strip craniectomy.
This is a significant paper, Alara. Sagittal synostosis, or SS, is the most common form of craniosynostosis. As we know, it results from the premature fusion of the sagittal suture, leading to that characteristic scaphocephaly, or dolichocephaly. For our residents listening, remember that the primary argument for operating on isolated SS is often cosmetic, as it mainly affects the skull shape.
Exactly, and that's what makes this study by Sapir Sadan and colleagues so relevant. Since the indication is largely aesthetic, the patient's and the parents' perception of the head shape and the scar is what truly defines success. This study investigated a very homogeneous group of 488 children who underwent a specific procedure, an early, open, wide-strip craniectomy.
Let's break down that cohort. 488 patients is a massive number for a single-center study in pediatric neurosurgery. What was the follow-up period?
It was quite extensive, ranging from 2 to 25 years. They captured patients as young as 3 and as old as 25. They used a retrospective design but added a qualitative layer by interviewing parents and the children themselves via a telephone questionnaire.
I like that they stratified the groups. If I recall, they divided them into 3 age ranges: 3 to 6 years, 6 to 12 years, and 12 years and older. This is crucial because a 4-year-old's parents might have different concerns than a 20-year-old who is looking at their own scar in the mirror every day.
Right, and the surgical technique was consistent across the board. These infants were operated on early, between 2 and 4 months of age, using that open, wide-strip craniectomy.
Let's get into the results. For the residents listening, when we counsel parents preoperatively, we often talk about high satisfaction, but what did the data actually show here?
The numbers are actually quite striking. Out of 488 patients, except for one single patient, every single responder stated they would undergo the surgery again. That's a 99.8% yes rate.
That is a powerful statistic for a cosmetic procedure. Only one patient out of 488 said no. Did the study elaborate on the general satisfaction?
Yes, they reported an overall very high satisfaction with the aesthetic results. However, because they used a questionnaire that encouraged qualitative, quote, pearls, they were able to dig deeper into the minor complaints that often get missed in standard clinical follow-ups.
That's where the real clinical value lies. Let's talk about the scar. In the era of endoscopic versus open surgery, the scar is always a point of contention. What did the patients say about the wide-strip craniectomy scar?
Most concerns were mild. They described things like local sensitivity, pruritus, or itching, and some difficulty with haircuts. Some parents mentioned that the scar became more visible if the hair was very short or wet. But interestingly, these scar-related findings did not translate into overall dissatisfaction.
Did those concerns change as the patients got older?
They did. The study found that detailed concerns about head shape and the influence of the scar actually seemed to improve when comparing the 6 to 12-year-old group to those above 12 years of age. It suggests that as these children transition into late adolescence and adulthood, they either become more comfortable with the results or the physical appearance of the scar matures in a way that becomes less bothersome.
That's an important point for long-term counseling. We often see parents very anxious about the bony ridges or the dent in the early post-op years. What did the study say about head shape specifically?
Similar to the scar, the comments on head shape were mostly minor. While the paper acknowledges that assessing aesthetic success remains complex, the subjective assessment from the families was that the correction of the scaphocephaly was successful. They were looking at things like the width of the head and the prominence of the forehead.
It's worth noting that the study mentions SS mainly affects the skull shape and appearance. There's an ongoing debate in our field, which the authors mention by referencing Jehuda Solomon's work, about whether SS surgery is a neurodevelopmental necessity or an isolated cosmetic challenge. By focusing on this early, wide, open technique, they've shown that even with an open approach, the long-term aesthetic results are excellent.
And for the medical students listening, early here means 2 to 4 months. Why is that window so critical in this study?
At that age, the bone is still very malleable, and the brain is expanding rapidly, which helps mold the new head shape after the strip is removed. The authors emphasize that this early intervention, combined with the wide nature of the craniectomy, allows for significant remodeling.
I found the comparative analysis between males and females interesting as well, though the high satisfaction was consistent across both genders. The study also included a table reviewing other long-term studies, like Salacorpi's 2019 study, which had a 26-year follow-up and also showed excellent outcomes comparable to the general population.
True, but this 2026 study by Sadan et al. Is unique because of the sheer volume, 488 patients, and the focus on that specific wide-open technique, without necessarily needing the complex vault remodeling or the helmets associated with other methods.
Right, and they noted that even though initial impressions are important, initial impressions may change over time, and subtle concerns about head shape or aesthetic appearance may emerge as the child grows. That's why the 25-year window is so vital. It confirms that the satisfaction isn't just a honeymoon phase for the parents, it persists into the patient's own adulthood.
Let's talk about the pearls mentioned in the methods. They called them qualitative responses. Did any specific patient comments stand out in the paper?
The paper notes that the questionnaire captured, quote, minor aesthetic concerns, but it emphasizes that these did not diminish the overall success. The pearls mostly revolved around the practicalities of the scar, sensitivity during hair brushing, or how the hair falls over the incision. It's the kind of subjective data that a cephalic index measurement just can't capture.
Exactly. As surgeons, we often obsess over the cephalic index, the ratio of the head's width to its length. But a patient doesn't live with a ratio. They live with a scar and a mirror. This study proves that our subjective surgical goals align well with the patient's long-term lived experience.
To summarize for our listeners, the study concludes that the long-term subjective aesthetic results of early, wide-open strip craniectomy are excellent for both parents and children. Despite the presence of minor findings like local pruritus or sensitivity at the scar site, the overall satisfaction remains consistently high.
And perhaps the most impactful takeaway, 487 out of 488 would do it again. That is a very reassuring message to give to a mother or father sitting in your clinic worried about their 3-month-old surgery.
It really is. It's a testament to the durability of the specific surgical approach.
Well, that's a perfect place to wrap up. A big thank you to Sadan, Costantini, and the team for this massive contribution to the literature.
Agreed. Thanks for joining us on the Neurosurgery Hub podcast. We'll link the study in the show notes.
Until next time, I'm Dr. Aris.
And I'm Dr. Alara. Keep learning.